did my training in Nebraska, in the States. Trained in family medicine. Over the years, I did family medicine, then I did prison medicine, and then I did hospice medicine, and then about 2 years ago, I went into cannabis medicine. And met these lovely ladies like 6 months ago, 8 months ago or so, and we had common interests, so that's why I'm here. So I work in Colorado Springs, and in Colorado we have medical cannabis, so people have to get medical cannabis cards. And so my job is to go ahead and assess them when they come in, have them tell me what their ailments are, et cetera, and decide whether they get a card or not. And then go ahead and provide them with information about how to appropriately use cannabis. Of course, up there we have CBD, THC, et cetera. Thank you. I'm sorry. Don't want to spill.
Anybody else want some coffee while we've got it hot? Black, okay?
So what I'm going to talk about is medical cannabis, and I'm going to talk a little bit about THC as well as CBD and a variety of the other ones, just to sort of give you the whole scope, at least, of what we have there. I understand that you don't have legal THC here, but you may have clients that end up using THC along with their CBD, so I think it's important that you kind of know about the variety of things that can be done. Okay, so here are my objectives. Give you a brief history of mankind's relationship with cannabis. Educate you about the different components of the plant. This may be kind of redundant for some of you, but I want to just make sure that I cover everything. Provide information regarding the research on the cannabis plant. Explain the endocannabinoid system to a slight degree. Explain how this medicine became a Schedule I. Well, in the United States, there's an organization called the Drug Enforcement Agency. They rank drugs on a scale of 1 to 5, and we'll talk about that, but how it became Schedule I in the United States. Talk about the potential benefit of the different cannabinoids and ways of getting it into your body, and talk about some of the pitfalls of the current environment in the United States and some of the things that I'd like to see you avoid when you come here. So, first question is, first written reference to mankind using cannabis medicinally came when? This is probably not something that you maybe know. So when did we, no, okay. So when did mankind start using it as a medicine? That's right, almost 5,000 years ago were the first written references to using cannabis as a medicine. So mankind's been using it as a medicine for a long, long time. Just a brief thing, the U.S. Pharmacopoeia is a pharmacologist's cookbook on how to make medical cannabis preparations. This is, again, it's the U.S., but I want to kind of give you an idea of the history of it. It included cannabis in it as a treatment from 1862 to 1938. So there was actually a book that told pharmacists how to make cannabis preparations during that time. And here's just an example of the medicines that they had. So cannabis indica, I think one of these probably had some chloroform in it. It was for kids and stuff. So really interesting, but there were a whole lot of cannabis products back then.
I thought it said honeycomb plus.
that would have been a big
All
seller.
different, yeah.
Okay, so we talked a little bit about the DEA and the Scheduling I. So this is what they call a Schedule I drug. Drugs with no current accepted medical use, I need to fix that, and a high potential for abuse. So here are Schedule I drugs: heroin, LSD, peyote, methamphetamine, and marijuana. Okay, I didn't put marijuana in there. But that's the level of Schedule I, whereas Schedule V drugs have lower potential of abuse and consist of preparations containing limited quantities of certain narcotics. And a Schedule V drug would be tropsters. So, so cannabis got labeled in a Schedule I, and that's been the problem with being able to do research. Because of its Schedule I, it has no medicinal use, etc. And we know that that's not true, but that's what happened starting back in the mid-1930s. So, why does it work in our bodies? And stop and ask me anytime along the way. So, how many people know about the endocannabinoid system? Oh, well then that's good, all right. So the body, so most people have heard of the endorphin system, and we think that now we're starting to sort of think that the endorphin system and the endocannabinoid system are very, very similar in our body, but we actually make our own cannabinoids. So we have something called the endocannabinoid system, and there are two main receptors to cannabinoid type products, but we think that there are more. We probably 4 or 5 have been discovered by now. 600 million years ago, started off in animals. I think it was sea squirts or something way back when the ocean or the world was covered with water, etc. So it's been around a long time. Present in all animal forms except insects. So any animal, fish, etc., they all have endocannabinoid systems. And we didn't know about this. We didn't know what an endocannabinoid system was until sort of in the 1980s, but the THC was first discovered by Dr. Meshulam in Israel back in the 1960s. And so that was sort of the first discovery of a cannabinoid. In 1988, they discovered the first cannabinoid receptor was discovered in the brain of a rat. So we first discovered the cannabinoids, and then in '88 we finally discovered the receptors that they went to. And the first endocannabinoid, the ones that we make, called anandamide, was discovered in 1992. So it's sort of like we found THC, then we found out that we have receptors to cannabinoids, and then we started finding our own cannabinoids. So the two receptors we know the most about, we just call CB1 and CB2. However, now as we progress and there's more research, we know that there are a lot of other receptors that are in the body besides that. We kind of focus on the CB1 and CB2 because we know the most about them as far as how the cannabinoids interact with them. And we believe that the main function of this system is to provide homeostasis in the body. So it's kind of like what Diane was talking on the walk. This plant has some type of attack on it, it does something in response. So we think what the endocannabinoid system does is when, I explain to my patients, I think when things get knocked out of kilter, you get an infection, you get an injury, etc., that the purpose of that endocannabinoid system is to sort of get us well again. Okay, and I'll talk a little bit more about why that sometimes doesn't happen. CB1 receptors are mainly in the brain and responsible for the high felt with THC. So when people, it's obviously one of the most common uses of cannabis is for people to smoke it, get high. It's because it hits these CB1 receptors in our brain, and that's part of where the high comes from. CB2 receptors are at the cellular level. It's quite different. It tends to be on immune cells, and endocannabinoids tend to be made when they're needed. So they're not just floating around our body like red blood cells or anything else. What happens is a signal comes down, says we need to have you crank out some endocannabinoids, hits the immune cells start going ahead and putting out the endocannabinoids. And then they get chewed up and used up in a very short period of time. So they're not just running around our body kind of like thyroid hormone. So thyroid hormone is constantly circulating in the body. That's not true of the endocannabinoids. So, page 3 of the booklet. Let's see, where's the booklet? So, in your, whatever you call that bag. So, page 3 is this one here. Okay? And what I want to show you, so this is just an illustration of how cannabinoid receptors work, so that you see that the notch in CB1 is different than the notch in CB2. So that means that it's going to take a different cannabinoid to get into that receptor. And you notice that it shows the receptor on the outside of the cell, but it goes to the inside of the cell. And that's partially how this works. So when you have a cannabinoid come in, it gets into one of those receptors, it makes a change on the inside of the cell. Any questions about that?
I have one. Is there any known lack of endocannabinoid?
Yes, but now they're starting to think that there's such a thing as endocannabinoid deficiency. Don't have a good handle on exactly what does that, but we think in some places like, are you familiar with fibromyalgia? Okay, so fibromyalgia is sort of an immune system problem where people have pain all over. They just really hurt when you touch them. They think that that may be part of it. They think that some diseases kind of like autism may also be a deficiency, but they haven't been able to go ahead and pinpoint it down and say, okay, this disease is caused by deficiency or not. Part of what we think why there is such a thing is that when you go ahead and treat it with cannabinoids, they get better. So, but it's an area where there's a lot of research going on. Okay, but we don't know particularly why, unless Diane knows, why people have a deficiency. Okay? So this is another one, again showing CBS, and this is in your book too. But what you can see is, here's CB1 receptors, and you see the light blue, and it's mostly in the brain, the central nervous system, a little bit scattered around the body. And you look at CB2 receptors, and you see that they're scattered mostly in the body, liver, spleen, etc. One of the things, does everybody know what a synapse is? Yes, okay. So this is an example of the synapse, and this is where the cannabinoids frequently work. So what happens is that, say you have a pain signal that's heading for the brain. So you hit your hand, it hurts, the pain signal goes through the nervous system, through the synapse up to the brain. It said, you hit your hand, it hurts. Okay. What happens at a synapse is that you get a release of chemicals. There's a gap here, so it isn't, nerves don't touch each other. The ends of nerves sit right next to each other. And then when you have electricity that comes down here, it makes these little packets of receptors or neurotransmitters go into the gap, which allows it to go ahead and cross over and go to continue electricity down. Are you familiar with spark plugs for a car? Okay. So spark plugs for a car send a signal or a spark across a little bit of a gap. And I tell people that if you have an old car that's using a lot of oil and stuff, that little gap will get full of carbon and all gunked up, and the spark won't jump the gap. Okay? So what we think happens sometimes is that the neurotransmitters, there's not enough of them to go ahead and make that signal jump the gap. One of the other interesting things about cannabis and the receptors is that cannabis actually, if this is, say this is, again, having pain, lots of signals going to the brain saying pain, 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 pain. What we think happens with cannabis is that it actually, the receptors will go ahead and feed back to this one and tell it to slow down. So it cuts down on pain signals going to the brain, so there's actually a feedback loop that comes from the, what we call this is the postsynapse neuron, and this is the presynapse. So cannabis will get in here, send signals back up here and say, stop firing so much, stop sending so many signals to the brain, and therefore cuts down on the sensation of pain. Okay?
It's all like perception only. It's only perceived as that you're not having any more pain or less pain.
Less pain. Less pain. And it's no different than sort of how the opioids work. So that's kind of how narcotics work to a little bit degree, is that they tell the brain, ignore the pain a little bit more. Okay? Hemp versus marijuana. Again, hemp, we'll talk about it. Hemp. This is a U.S. government thing that hemp has less than 0.03% THC. Now, that's pretty much adopted universally by most countries. Some countries will say it's 0.4, some will say it's 0.5, but it's all very low. So for a plant to be called a hemp plant, it can't have more than 0.3% THC in it. Okay. In 2000, 2018, the US passed a farm bill because it used to be that, because the marijuana plant and the hemp plant are very similar, okay, or almost identical, it was causing a lot of confusion. So in 2018, they passed a farm bill that said, okay, if it makes less than 0.3% THC, it's a hemp plant and you can grow it, you know, it's got more than that, it's a marijuana plant, you can't grow it, okay, unless you're in a state that has legal. And it's really interesting because in the US, from a federal government standpoint, all of it is illegal. Even CBD is illegal, basically, okay? But what's happened is that they've left the states alone that decide that they're going to go ahead and have medical marijuana or recreational marijuana, so the government isn't getting in there and tearing up the plants and shutting people down.
No, they're busy at the border.
Yeah. Hemp fabric, so hemp, mankind's been using hemp, it's like Diane was saying on the trip and stuff, that, you know, the plants have been here long before we were here, so we've discovered when they do archaeology that man's been using hemp for at least 10,000 years. Now that's, we don't know about it medicinally because there's no records from back then, but it's been around a long time. But here's some of the things that they used to use it for, and they still do to some degree: paper, textiles, rope, fuel oil. Back in the late 1800s, early 1900s, they grew a lot of plants. They made sails for sailing ships. You know, so there were a whole lot of uses. In fact, I've been told that when, again going back to the U.S., that when the Pilgrims and those people came over to settle the United States, they were required to grow hemp as part of what they did. They brought it with them. So it's used for a whole lot of other things. Again, the problem is, until, at least in the U.S., until 2018, it was all considered to be illegal because it was marijuana. Marijuana, as I said earlier, has over 0.3% THC by U.S. standards. And there've been, I don't know if you have no different, but I know that there's at least 100, and they're just finding cannabinoids every year. They've got more and more cannabinoids. So there's, you know, we talk about THC and we talk about CBD, but there's CBG and CBN and THCA and so on and so forth. So tremendous number of cannabinoids when they've started doing it. The nice thing is that other countries besides the United States have done a lot of research, and I'll talk about that a little bit. So Israel is probably one of the leaders in the world as far as cannabis research.
Now, real quick, on the CBD versus like CBG, you see a lot of hype with a lot of MLMs with the CBG. Is there really not enough research done to actually promote that as being better than CBD?
Right. So the problem is that, first of all, the amount of CBG that's produced is very small, so it isn't readily available. And because of that, the research isn't out there. You see a lot more research on CBD because people can then go say, well, look, we've got a great product, okay, and this will do this and this will do that. It's just starting to come into its own. I probably think in about 2 or 3 years there'll be more research on CBG. And it won't surprise me as we go down the line and experiment with the cannabinoids that we find out, oh, there's something a hell of a lot better than CBD out there. You know, it's, you know, CBN or whatever it is.
But for right now, they're kind of jumping the gun.
Yeah.
Without really knowing.
So there are people who say, well, it's great for this or this or this, but what good does it do you if you can't get it? You know, so like I said, well,
It's
this is really.
outrageously expensive.
Uh-huh.
As an isolate, it's outrageously expensive.
And that's because the plants don't produce a whole hell of a lot of it, so you can't. Okay. I say there are about 8 that we have a pretty good idea about, okay? So we know about the THCs and the CBDs and the THCAs and stuff. So in terms of research, there are about 8 of them that we have a fairly good idea of beneficial properties. So, like I said, most of the research is done outside of the United States because of Schedule 1, but Spain's doing it, Israel's doing it, Canada's doing it. So we're fortunate enough to have countries who said, all right, we're going to go ahead and do some. So some of the reports and the research and experiments have actually come outside of the United States. Just recently, they've started licensing a few research places to be able to go ahead and get THC and CBD and do research on it. But that's part of one of the problems. And so when you, at least in the United States, when you talk to traditional Western doctors, and I was trained as a traditional Western doctor, it's sort of like, there's no research out there. You know, how do you know that it does this or that? Talked about Israel, Canada, New Zealand, Australia. What are they doing? Yeah. One of the things that they come back to is in the United States, the standard, starting about 1980 or whatever, was to do double-blind studies. A double-blind study is one where you have 2 capsules, one with an ingredient, one with nothing but a placebo, sugar, whatever it is. 50 people over here take this one, 50 people take this one. The doctors looking at the people don't know who got the good capsule or the bad capsule or whatever. And then you compare them and see, okay, did the people who got it have, at the end of the study when they're doing the analysis, did they get better? Did they not get better? Did they have... That's starting to actually fall out of favor in the United States, but that's kind of still the standard. When you see with cannabis research, a lot of it is observational research. Observational research is where you know the people who are taking it and not taking it, and you're looking at the differences between those populations. Let's just say somebody has severe rheumatoid arthritis, lots of joint pain, etc. You get the 2 groups, these people start taking CBD and or THC, etc. You have them fill out questionnaires, you know, how are you doing, etc., etc. And then you have these people over here who are not taking it, but you know that they're not taking it. And then you see there's a difference. The reason for the double blind having come into favor was because it eliminates the placebo effect. So I think the placebo effect is where you give somebody a pill, you tell them it's going to work, 30% of the time, even if it's a sugar pill, they feel better. Okay, so that's sort of the reason for the double blind. Right now, there are a tremendous number, and thankfully growing, number of observational studies where they're finally saying, okay, look, you know, we know you're taking it, we know you're not taking it, etc., but the change in the people that are taking it is so dramatic that you just can't say it's a placebo. This is another problem. When I started getting into this, I said I've been in this 2 years. So you go ahead and look at some of the research studies and they say, well, we gave them cannabis. But they don't say we gave them THC, we gave them CBD, we gave them 1-to-1 or whatever. And that just muddies the water. It's kind of like we know so much different. So that's one of the problems with some of those studies that are out there is you don't know. And because we know that there's such a significant difference in our body's response to THC versus CBD, it just muddies the water. In the United States, they've approved this thing called Epidiolex. They actually make it from the marijuana plant. It is a CBD, THC type product. It's for seizures. And they made it a Schedule 5. So when Big Pharma gets involved, guess what? They can make things sort of change a little bit. It's okay. So it is coming, and one of the concerns that I have is that Big Pharma, of course, when Big Pharma gets involved, the prices go up, you know, and they're already, Big Pharma is jockeying with the federal government to try and make CBD and THC restricted so that people can't, that they just have to buy it from them. Okay, so PubMed is just, this is again something that I use to teach patients and or physicians in the United States. PubMed is a repository for all the research that ever is done. So anytime somebody publishes something that's research, whether that's medical research, whether it has to do with toe fungus or whatever, it gets deposited in PubMed so that anybody can look at it. And if you put in cannabis, you'll see, this just was probably a few months ago, but it's much higher. You'll see that there are over 19,000 reports, experiments that are in PubMed. And if you search for medical cannabis, you'll see 6741. So that's a lot, and I used narcotics to compare it. So hydrocodone, which is called Vicodin or Norco in the United States, is a narcotic that's frequently used to treat pain. So you go look at hydrocodone, 1,100 studies. And you look at oxycodone, which most people would know as Percodan or Percocet, 3,400. So when I have people who say there's no research out there, I say just look at it, and see, because there has been a lot of research done and a lot of studies published. Okay, let's talk a little bit about safety. Nobody's ever died of cannabis, and I should say THC, but there's never been a published death due to cannabis in the world. Okay.
When you mention cannabis, you mean the full plant,
Yeah, I'm talking about the
THC.
plant and its derivatives, whether it's THC or CBD, but mostly the overdose concern has always been about THC.
Okay.
Okay? So nobody's ever died. However, 46 people die every day in the United States because of narcotic overdose. Okay? And it's probably higher than that now. It's estimated you have to consume 1,500 pounds of cannabis in 15 minutes to be able to go out to kill somebody.
Let's try.
Close.
Yeah. So it's just 20,000 to 40,000 joints that you would have to smoke in 15 minutes. So you'd probably die of asphyxia because you wouldn't get enough oxygen in there. But it won't be from the cannabis. So the safety is just way down there. When you compare it to narcotics, there's no comparison at all. Okay. Now, this is one of the things that I wanted to talk to why I had you put that cap on your computer. So one of the problems in the United States, especially with CBD, is that the marketing has far outstripped the benefits of the plant. Now, we all know that the plant has a lot of benefits, but you would think, based on the marketing, that if you go ahead and take some CBD, you could walk on water. Okay? It's just absolutely amazing. And about 2 months ago, I was in a hardware store, kiosk of CBD, went to a gas station, kiosk of CBD. And there's no instructions there. So the marketing is way out there. People are going ahead and they're jumping on the bandwagon to go ahead and make a lot of money, but they're not following up with instructions or information on how to appropriately use it. And the concern about that has to do with this. Now, most of the time, the problem is with THC if you're taking a lot of drugs. So there are a lot of elderly, 70, 80 years old, got arthritis, got back pain, etc. They're on some type of arthritis medicine, but guess what? They've got a little bit of heart disease, and they're on a heart medicine, and they're on a blood pressure medicine. So it's not unusual for them to be on 7 or 8 medicines at the same time. They go out, they buy the CBD, they have no instructions, there's no warnings on it, and that's one of the things I'd like to see not happen in Panama, that, if you have it, if you're going to go ahead and take it, you need to know whether or not it's a problem, and we'll get into that a little bit deeper in just a second. Okay, most THC interactions are with opioids, tranquilizers, antipsychotics, alcohol, and some antihistamines, and the most common interaction has to do with sedation, dizziness, etc. As a rule. So they always caution people, if you're taking narcotics can sedate you, and if you add in some THC, potentially you get a little bit more sedated. One of the problems with narcotic overdose, the reason that people die is because it suppresses your respiratory system, so you stop breathing. Not good for living, okay? But cannabis doesn't do that. It doesn't get into that center of the brain that stops breathing. But I could assume that if you're using both of them, you may not be aware as much of how sedated you're getting. Most interactions, like I said, are increase in sedation and dizziness. Now, let's go to our smartphones and pull up that drugs.com. And what you're going to see is looks like about 15 different
Okay, the third question they are asking, preferred content for healthcare professionals?
Do what?
Hmm?
Prefer, well, mine is asking.
Yeah.
Okay,
Preferred content for healthcare professionals, should we say yes or no?
yes.
Yes. Okay, thank you.
All right, and then did it come up with 15 little boxes?
Yes.
Okay. So when you get to the 15 little boxes, you're gonna go down the right-hand side, the third one down says interaction checker, okay? And then it's gonna say enter a drug name, okay? Now, we can enter several different names, but if you enter cannabidiol, you start entering and you're gonna see it come across the screen just below there. Click on cannabidiol. Got it? Everybody? Okay, and you're gonna put add, okay? And then hit your back button. I don't know what it's like. And you're gonna see a blue bar on the bottom that says check for interactions, okay? So if you just, this is just cannabidiol, we didn't put in any other drugs in, okay? If you just push on the check for interactions, it's gonna come up and it's gonna say there are 9 major drug interactions, 500 moderate drug interactions, 1 minor. So major ones are ones that you have to be really careful about. That means that there's maybe some really significant issues there. And then, if I'm not mistaken, you go down, scroll down just a little bit, and you'll see most frequently checked interactions. Got that? Yes, so then it's gonna give you a whole list, okay? So, then let's just go ahead and pick one. Let's pick a lead, which is naproxen. Everybody kind of knows what ibuprofen is, or Advil. So naproxen is the same thing. So you click on naproxen, and then you scroll down just a little bit more, and it says interactions between your drugs and naproxen. So it says naproxen, cannabidiol, and it says moderate. Okay, and then it starts telling you may cause liver problems, etc. So they're sort of saying that if you're going ahead and use the CBD, naproxen causes liver and kidney problems just by itself, not anything else, okay? All right, but then it goes through and it talks to you a little bit more generically about here's some of the things that you have to watch out for. So moderate drug interaction doesn't mean that you can't take them together, it just says here's the things that you ought to watch for. If it says severe drug interaction, let's see if I'm gonna go back. See what alcohol says. No, I want to see what the major drug interaction.
Major.
Let's see here. I don't think it does. No, I can't find it.
Nothing.
Okay, so let's go back to the ad. So you already have, when you go back to ad,
No, I'm lost.
okay,
Just hit your back button.
I'm lost somewhere.
You might have got
you're
it.
way down the road.
Oh,
No,
you're
no,
into
it's
it already.
alright.
You're in the wrong app. You're looking for prices on drugs.
Yeah. Drop that con and so let's go back to drug interactions checker. So you already have cannabidiol in there. So let's enter another drug and let's put in warfarin. W-A-R-F-A-R-I-N. And hit add.
Warfarin?
Warfarin, W-A-R-F-A-R-I-N. And then you scroll down again, so you've added it. All right, where are you? And then you go to the check for interactions button, blue bar down here. Okay? And you scroll down a little bit, and it says moderate warfarin, etc., with cannabis. But actually, it's one of the things I caution people about it. Diane talked a little bit about one of the plants out there. So warfarin is Coumadin. Coumadin is a blood thinner. What happens is that the cannabis, whether it's CBD or THC, but mostly THC, competes with the metabolism of warfarin. So if you start taking a lot of CBD and you're on warfarin, what happens is your warfarin level goes up, your blood gets thinner and thinner and thinner. You have to get to pretty good doses of it, but it's a good example of one of those that can be really nasty, because if your blood gets really thin, you can have a bleed, stroke, etc. Okay?
Doc, would that be the same instance if you're on a low dose baby aspirin?
No,
No,
no.
wouldn't impact it.
Completely different mechanism, okay? So, and you can do the drugs.com online, so we already kind of went through this. You go to interactions, check your accept, enter cannabis, marijuana. One of the nice things, when I first started doing this, it just had cannabis and marijuana was a thing, and now they're starting to put in cannabidiol and stuff, so they're starting to differentiate a little bit. And we talked about checking for interactions. These are major interactions, and again, the big difference is, if you look at, this is THC or cannabis in the old system that they had, 129, you go to CBD and it says 5. So big, so now they're starting to peel that out a little bit so you have a better idea about what exactly does it. So this is what I said, doesn't differentiate, this is the old one. And again, most of the drug interactions are with THC. A lot of them have to do with mental antidepressants are another big one, okay? Antidepressants, tranquilizers, antipsychotic drugs, they're all ones that have potential issues with this. Some antihistamines, so I think it's real important because people go off and they buy Benadryl, which is diphenylhydramine, because they have a cold, they have allergies, etc. And for a lot of people, that's very sedating. Benadryl is very sedating, and you need to throw in some THC, and you can get a multiplying effect on it. Opioids, as I said, are a really big one. Now, we'll talk a little bit about people actually using this to get off of opioids. Alcohol, again, is another one, so sedation, dizziness, etc. So these are kind of the common, I just put in a few of the common ones. So THC is, everybody knows, the one that gets you high. THCA is actually what the plant makes. This is what the marijuana plant makes. The little a stands for the acid form of THC. THCA will not get you high. So I tell my patients, I say, look, if you decide you want to go ahead and eat a marijuana flower, you want to have a marijuana leaf salad, whatever, you can eat the whole thing. No high, but you're going to get some THC, and we'll talk a little bit about the benefits of that. CBD, we kind of know a little bit about that. Again, not psychoactive. We're sort of changing a little bit when we talk about not psychoactive. It sounds, what we really mean is it doesn't get you high. CBD actually is psychoactive because you give it to people who are anxious, it calms them down, can help with sleep, etc. So it does have psychoactivity, but not in the same way that THC has. CBDA, again, is not psychoactive. It's in the hemp plant. So if you add the hemp plant that has high CBD levels, that plant is making CBDA, okay, not CBD. So THC, psychoactive, like I said, gets you high. Principally binds to CB1 receptors in the brain. Okay. This is true for the United States, not true for down. I don't think it's true for down here. I don't know. Maybe the quality of plants that they make down here grow are better. But back in the old days when I was young, it was you consider. If somebody said it was sensimilla, you just go crazy about it, because you thought it was great. It had about 3% THC in it. Okay. Nowadays, they're pushing 25 to 30% THC. So just tremendous difference with Alta.
You go to 40%. They go to 40%.
They're up to 40% now. Wow. And so that's problematic for old folks like me who are sort of used to what happened when you smoked a joint back in the time, and now, they go ahead and say, I'm gonna smoke a joint, and they're just blacked out,
For days.
for days. Back in 1860, I think is when they labeled the plant as sativa, indica, and rufulus?
Yeah,
Rufulus?
yeah.
Okay, nobody knows it. Uses rufulus, it
Like
doesn't,
a- yeah.
doesn't have it, okay? I just looked this up last night. What was it? 1,000 hybrids or something like that? So, and we're kind of getting away from this. So hybrids is where now they're combining the indica and sativa, and everybody will say, okay, ours is the best because it's 30% sativa and it's got 20% indica in it, and here's the high you're going to get from it, etc. So the labels of indica and sativa, you'll still hear people using that, but it really has to do with the CBD, THC, other cannabinoid contents of the plant more than that. So, and nowadays, because of all the hybrids, all bets are off. Really, really, really good for chronic pain. I have patients who've had multiple accidents, have had multiple back surgeries, and when they use it right, they get tremendous relief. Depression, anxiety, insomnia. A lot of my patients are using it for insomnia. They don't necessarily use it right because they say, well, I go ahead and smoke, so I go to sleep. Yeah, and then what happens 3 hours or 4 hours later when it clears your body? So, and we'll talk a little bit about that. You're going to be responsible for time.
No, we're good, we're
Yeah.
good.
Well, somebody needs to
I'm
tell me it's okay.
I'm the organizational
Okay,
Nazi.
all right. All right. Everybody knows about the munchies when you get the THC. Really good for nausea and vomiting, especially for people who are getting chemotherapy. And I'm just absolutely amazed. I didn't know this until I got into cannabis, but there are conditions called ulcerative colitis or Crohn's disease where the inside of the intestine or the bowel is extremely inflamed, lots of diarrhea, lots of pain, and they start using this and using it with some CBD, and they get off all their other colitis medicines. Just absolutely amazing. Neuroprotectant. This is really neat. We talked a little bit about how this affects the nerves and the synapses and stuff like that, and what we think. There's a condition called we call it chronic regional pain syndrome. An old word for it was peripheral neuropathy. So people that have diabetes or they've had an injury to a nerve, say in the arm, where it continues to hurt even though the thing that caused the injury wasn't there. So we call that peripheral neuropathy. What we think is that this plant and the cannabinoids actually help repair some of that, or at least in the instance of diabetics. So diabetics frequently, when they've had diabetes for 15 or 20 years, will start getting pain in their feet and their ankles and their lower legs. That this actually slows down that process, if not stops it completely. Anti-inflammatory. So we talked a little bit about fibromyalgia, but most arthritis is an inflammatory process, so this reduces it, okay? I talked a little bit about THCA, it's what the plant makes, not psychoactive, but it converts to THC when it's heated, so you bake it, etc. Anytime you heat this, it'll go ahead and turn into THC. It loses that little A. We call that decarboxylation, is that process of heating. So when you smoke it, heats it up, and you vape it, vapes, heats it up, etc. You bake it, heats it up, and it turns into THC. However, it's also anti-inflammatory, anti-tumor, anti-spasmodic, anti-convulsant, so it has a lot of great properties too when you just take it straight out of the plant. So if you make teas from it, as long as you don't heat it, you're going to get a lot of THCA. And there's starting to be a little bit more of this in the United States. You're starting to see some companies who produce THCA products. Okay, CBD, second most common prominent cannabinoid in the plant. If that's a marijuana plant, if it's a hemp plant, then that's the most prominent cannabinoid in it. Binds to the CB2 receptors, Won't get you high, but it is psychoactive. Will treat anxiety, will treat depression, etc. Will block the high of THC if it's in a significant enough ratio. So I do this with my patients all the time. Is I say, okay, look, they're always, when I talk to them about using CBD and THC together, okay, so what happens if we think is that the CBD gets in the brain and it sits right next to that CB1 receptor and it keeps that THC from getting into that receptor. So if you have a high enough CBD to THC ratio, you're able to go ahead and use that with THC without getting high. And I do this with my patients who still have to work, take care of their patients, or take care of their kids, etc. Is they say, oh, I can't take any THC during the day. I said, no, yes, you can. And typical ratio is 4-to-1 that won't get you high. That's a typical, but some people are really sensitive to the high of THC, and others, I'll have people take 100 milligrams of THC and they go, nothing happens. Okay, so one of the things you'll find out about this plant and the cannabinoids is that there's huge human variation in how sensitive you are, how you respond to it, etc.
Does the CBD attach better to the body with the THC molecule?
Say what?
Does the CBD molecule attach better to the body with THC on the bottom?
Does it attach to the THC receptor?
Your body better.
Oh, it really depends on where you're talking about in the body. So the CB1 receptors mostly, the THC will attach to other receptors in the body that are THC receptors. So they're not all in the brain and the spinal cord, if that's what you're asking. Okay. CBD will also attach to CB2 receptors in the brain. So they cross over a little bit. Okay. Did I?
Yes.
Okay. So CBD. Okay. And what does it do? Well, it's anti-inflammatory. I am privileged to work with a physician, if you've ever heard of Charlotte's Web. I'm not talking about the movie, but Charlotte Figi was a little girl who was born with the type of seizure disorder where she had about 300 seizures a day. Okay, and they went through all the seizure medicines, etc. Dad was military. Mom and Dad were really skittish about trying this, and somebody gave them some CBD. So Charlotte was probably having, I think, somewhere around 25 seizures an hour. Okay, and so Mom and Dad finally said, okay, let's give it a try. Gave her some CBD. 30 minutes passed, no seizure. Hour passed, no seizure. 2 hours passed, no seizure. So Charlotte's Web got named after Charlotte Figi, the little girl that had the seizure disorder, but it was a CBD product produced by the Stanley brothers in Colorado who grew the plant, the CBD plant. Okay, tremendous boom to kids with seizures. And my partner was the one that actually gave Charlotte the medical card to be able to go ahead and start taking it. And because of that, she's sort of the guru in Colorado for kids with seizures, and we'll have neurologists, children neurologists at the medical school send kids to her to go ahead and get them started on some CBD.
Dr. Rock, question. That initial dose of CBD that they gave the child, do you have any idea how much they gave?
Absolutely not. Absolutely not.
Yeah.
And I don't know if they knew at that point in time either, because I don't know that they had it tested.
Right.
Roy, was she like 8 years old, something?
Something like that, yeah, 7 or 8 years old.
Would
And since then, there's just story after story after story of these kids that have had these horrible seizures that get benefit from it.
Would it have a similar effect on a grown adult?
Yes. Anti-anxiety, we talked a little bit about that. Antidepressant. Antibacterial, so it's really interesting, and they're starting to learn a little bit more about it, but as Diane said when we were out on a walk, there are a lot of things that can go ahead and kill bacteria, viruses, etc. This happens to be one of them. Anti-tumor, more and more is coming out about using it. Right now, it seems like they're sort of skewing a little bit more towards THC being a little bit more potent as far as tumors go. But I've had patients come in who've had lung cancer and they say, I just did the THC CBD thing, didn't do any chemo, and I haven't had any problems for 5 years. I never recommend anybody stop all that. I said, but, you know, if it were me, I would add that in. Okay, but what we think it does for tumors is we think it tells the tumor to stop splitting. So your cancer just is a runaway splitting of the tumor getting larger and larger, and we think it says, okay, time to die. So don't split anymore, and so I expect that to become a really big thing here in the future. Pain reliever, we already talked about. Muscle relaxant. One of the diseases that it works well in is multiple sclerosis, and they tend to have a lot of muscle spasms and stuff, and it'll help cut down on the spasms. Antiemetic, which means that it helps nausea and vomiting. Okay, this is in your book, I think, isn't it?
Yeah.
Okay. This is just what I did in the book, and we'll go over the book at the end a little bit to show you. But basically, it's just a schematic to show you that, number one, you see that CBD is prominent, but if you look around the periphery here, it talks about anti-inflammatory, antipsychotic. So it's just an illustration that you can use if you're showing people, trying to show them, give them a picture of what this can do. Is it in here? Nope.
I saw it, but
All right.
What were you smoking?
Yeah. You guys, what I'll do is, and I didn't put it on, I have flash drives that have so much more on it, you guys are gonna go nuts. I just like all sorts of information. But I'm gonna go ahead and give Elizabeth and Diane the PowerPoint so that they can redistribute. I didn't put it on the drive because I was making a lot of last minute changes, so.
It is true that cannabinoids are present in the 6th week of pregnancy in the mother's milk.
Present in what?
In the mother's milk at 6th week
Mother's
pregnancy.
milk.
Oh, mother's milk. I don't know. I've not researched mother's milk. I think they are, but I don't know.
I read that the cannabinoid teach the baby how to eat.
Oh, really? Okay.
I have read that as well.
One of my frustrations with having gotten into cannabis just 2 years ago is you go out and you could spend all day and all night reading all sorts of studies, et cetera, et cetera. And one of the problems that I have with that is sort of being a scientific Western medicine doctor is you have lots of people who are making this claim and that claim, and you have no idea what their background is. You know, they just, and especially given that a lot of people are using it to make money. So, this is another one. This is in the book? Okay. So what I wanted to show you is if you look at the center here, see gastrointestinal, mood, behavior, neurologic, etc. And as you go out, you can see CBDs, THC, etc. And talking about Alzheimer's disease, some nice research starting to come out on Parkinson's that has to do with tremors, etc. Tourette's. So this kind of is, again, another graphic that I wanted you to have to kind of be able to show people if you're trying to sell this stuff and say, look, here's what we know about this so far, that it can help in all of those various areas.
Leaflet is now classifying strains by terpenes, not by a receptor.
Leafly is?
They have
Okay. All right, that's nice to know, because I didn't know. Sometimes I have trouble with Leafly. Part of it wants to say, okay, somebody researched it, et cetera, and then part of it says, nah, I'm not too sure. Entourage effect, anybody know about that?
no.
So the entourage effect is where when you take 2 cannabinoids or 3 cannabinoids together, they actually boost each other. Because we talked about the THC primarily going for CB1 receptors and CBD going primarily for CB2 receptors. So if you're taking both of them, you're stimulating both receptors. And what I tell my patients is, I say it's kind of like 1 + 1 = 2.5. So the entourage effect is a boosting effect when you use both of these at the same time. And that's true of other cannabinoids too. I just use THC and CBD because they're the common ones that people most likely will use, but it will occur with THCA, etc. So the entourage effect is not only limited to that, it's also in terpenes. So when we were doing our walk and stuff, Diana was talking about terpenes in the plants and stuff. Terpenes are essential oils that occur in all plants, including cannabis. Okay. Now, one of the things in the United States is that they promote whole plant extract. So they have CBD, everybody starts saying it's the whole plant as opposed to the isolate. Well, that's because you can do the whole plant in the United States. You can't do the whole plant here. However, you can, all plants have terpenes, as Diane explained, in various quantities for what comes out of the hemp plant or the marijuana plant to provide therapeutic effects. And that's why you see all these different things up here, is because they're additive. So you can go ahead and get straight CBD isolate, which is what they get from the States to be able to go ahead and put in their things. And in the United States, you can buy straight CBD isolate. However, we feel that it's not as therapeutic as when you have terpenes in it to go ahead and boost the effect. These are the common ones: limonene, linalool, caryophyllene, etc. And when you go to, let me see here.
I have a bunch of them over here on display right now. Not from cannabis, not
So-
from cannabis, from our plants.
There's this in your chart, okay, and this again labels out or has pictures of the various things that are there. Underneath the name of the terpene, it says therapeutic effects, so we'll talk about whether it's antidepressant, anti-inflammatory, a little bit about aroma. There's in the flash drives you're going to get, there's an excellent one from Global, I think it's Global Cannabis, which will give you much more detail about each terpene and as far as its positive effects on your health.
It is true that the methane in the ripe mangoes potentiate the THC effects.
So you have this group over here that says if you go ahead and eat mangoes, when you do THC instead of boost.
No, really?
I haven't tried it. I think that there probably is some effect because I've seen enough of it published to sort of say, okay, go ahead and eat your mangoes and start smoking. But I don't know how much of an impact that has. So
That's the
It's a
name of
good
the
study
farm.
for Panama.
this is another terpene chart. Again, here are the terpenes on the inside, humulene, etc. And then it talks about what sort of effects it has: anti-inflammatory, antibacterial. The outer ring is a list of a variety of hybrids. So it kind of looks like what's called a periodic table where they have a name. Okay. And one of the problems I have now is that there's so many hybrids, and you've got Kush this, and you've got Golden Lion this, and so on and so forth, and it's really hard to tell. And each of them trying to sell their stuff claims that theirs is the best. Okay.
Yeah, 700
So-
now.
Huh?
Yeah, 700 now.
700. Okay. This is another terpene chart. Again, goes here, talks about effects, what other plants it's found in and stuff, and then the medical benefits. So when you guys get the PowerPoint, you'll have this if you want to go ahead and print it. Again, to start showing patients what benefits there are.
Can I just interrupt and show some, these are some of the plants that we have where we've done the extraction. And
For instance, we have lemongrass, which has been nerodiol, and
beta-carotenoids.
I have trouble saying that
I can't
one.
say that one.
You know, and we have, I mean, this is just some of them, I didn't bring them all out. Lavender for the linalool, for sedative and calming effects, that's in our Sleep Tonight formula, as well as a little bit in the Chill Out. Clove, great, it's both pinene and beta-caryophyllene. And so we put that in several of the formulas. And then of course, turmeric, I'm sure Diane has explained, is the powerhouse. This is this is in process. This is a 1-to-2 ratio of plant to the alcohol. We use like 150 proof alcohol for our extraction so that it's really, really intense. And this is kind of what it looks like. This one's almost ready. It's a month old. But what we have learned, both by research and experience and trial and error and report and all the other ways that you learn things, is we use a really, really pure 99.9% isolate from organic fields outside of Colorado, hemp fields. when we can measure and quantify the amount of the specific terpenes that we're adding to a formula, we get really better results more consistently than if you're depending on the natural terpenes that are grown in the plants, because the plants vary from plant to plant in the same field in terms of what they have generated naturally. So we feel like our approach is really, really good.
Sounds like when we were walking and you were showing us the plant there that had the cannabinoids and that other one was just green.
Yeah,
So
exactly.
if you're going through and picking all of them,
Mhm.
yes, some are gonna be stronger than others, so you can't regulate it.
Exactly, and we can quantify what we're doing here in a more controlled way. So, that's my speech on terpenes. We
Well,
love them.
and the same thing goes for the cannabis plants. You can have a field of marijuana hemp plants, and the THCs and the CBD ratios are gonna vary from plant to plant to plant. How they do when they process in the United States is they go take their 1,000 plants or whatever, combine them, and then they measure and see how much of THC or CBD.
Is better alcohol extracted terpenes or steam distilled?
Well, steam distillation is a whole different process, and we could do that. We actually have a steam distiller here. We find that the alcohol extraction, it's really, I'm not gonna say one is better than the other, they're just different processes. We feel like this is really working really well. After lunch and everything, I don't want you to spoil your appetite, you can come taste some of these and see how strong they are.
Doesn't the heat affect a lot of the things though?
It does
If you steam
indeed.
it, it'll be,
Yes, very good point, Stacy. And that's a problem with steam distillation. You do get an oil that has the aroma, the olfactory aspects of it, but you may be losing some of the medicinal benefits of it because it has to go through a higher temperature. We control ours so that it never exceeds 110 degrees when we're starting to blend things together. So we're pretty careful. We try to be anyway.
So here's and most people, I just kind of want to go over the different points of cannabis that we have in the U.S. Flower, topicals, tinctures, oils, edibles, concentrates, and suppositories. So if you go into a medical marijuana dispensary in the United States, you just be blown away. They may have the pure flower on one end, and they've got the joints, and then they've got the sads, and so on. So you have all of these, and I just want to talk a little bit about each of them. So what we call flower basically is the flower of the plant. If it's a female marijuana plant, it has the highest concentration of THC. Maybe have high CBD. Again, if it's a hemp plant and it's bred for that, it'll have a high CBD. You can smoke it, meaning that they have CBD joints. They've got CBD vape pens in the United States, as well as the THC stuff. And you can vape it. A vape machine is basically something that heats it to a specific temperature, but doesn't combust it. So one of the problems, or the differences between smoking it, is when you're smoking it, I think it gets to where 600 to 700 degrees Fahrenheit. Whereas when you vape it, the vape machine will go ahead and go to maybe about 350. It can be adjusted up and down. It doesn't combust it. So the problem with combusting it is basically any toxins that are on the flower and stuff you inhale when you go ahead and smoke it, okay? Don't get that as much when you do with the vape machine. And it's a lot gentler on the lungs, so now we're going through this big deal in the United States because of all the people that are dying from vape pens, but when you look at what happens, most of those vape pens are bought on the illegal market.
They're fake.
Huh?
They're fake.
Fake? Yes, yeah, and they put other things in them. So they go ahead and put in this vitamin E stuff. Some of them will even put in some narcotics, etc. into it.
so it's the cartridges.
It's the cartridges.
Even peace.
Huh?
They found a cartridge with peace in it.
With
That's-
what?
With pee.
Oh,
Urine.
yes. Yeah, so when and that's a big problem in the United States is because and I'll talk a little bit about that, but when you order CBD off the internet, They've done studies where they've gone out and bought like 80 different CBD products. They found out that 75% of them did not have the CBD quantity in it that they said they had. Somewhere around 25 to 30% had lower levels, if no CBD. 50% had a little bit higher level CBD, which isn't bad, but because it's unregulated, you don't know what you're getting. So I really, really counsel my patients about going out on the internet. There are companies that are very good, the Family Brothers, Charlotte's Web. There are a few of them that are very, what do I want to say? They're very good at distilling it, getting it right, etc. And there are a whole bunch of them who just sort of say, I can sell the pea for $50 a buck.
How would you differentiate the going into the store, the dispensary, and online? I mean, do you still have problems in the dispensaries also? Or
Not in Colorado. So in Colorado, actually, when they grow the plant, each plant gets a barcode.
Yeah.
And that plant is followed by that barcode all the way through from when it's a little seed or infant to the time they harvest it. And every product that's sold either in the recreational dispensaries or the medical dispensaries has to be third-party tested. They have to send it out. Somebody has to do it. Now, did they send out this one here that they knew was right, but they're making this over here? Don't know, but for the most part, I feel pretty comfortable. If it comes from a medical dispensary in Colorado, you know it has no pesticides, you know it has no bugs on it, no herbicides that are in it, etc. So I'm comfortable with that.
Yeah.
Again, you go out on the internet and you look for something that's cheap. Well, okay, why is it cheap? Well, they put something in the bottle and said, here it is, and then you get the placebo effect. You know,
Exactly.
There was a plastic toy in China yesterday.
Yeah. So for those of you, I just decided to throw up a plant to show you. And this is what we call a flower. Okay, so this is, again, we're talking about female plants. Now this fuzzy stuff, those are what are called trichomes. Have you heard of trichomes? Okay, so trichomes are actually where the cannabinoid is made. And I don't think I included my close-ups of that. No, I didn't. But when you look at it under high magnification, you just see these little balls and stuff. And so that's where the cannabinoids are,
It's like a mushroom.
like a mushroom.
They will have-
Oh, yes. So they look like a mushroom. Okay, so you can chew it. So in Colorado, if I have somebody who wants to have some THCA, I'd say, okay, go ahead and chew it, put it in your mouth like tobacco or whatever. You make a tea with it. You can make edibles with it. If you don't, it depends on whether or not to heat the edible. So if you want to make a gummy that has THCA in it, you just make sure you don't get it heated. The advantage of smoking or vaping it gets in your body in about 10 minutes. Disadvantage, it sticks around for only about 2 hours. Okay, well, if that's your goal is to get high for a couple of hours, that's the way to go. Okay. Edibles basically is any form, I call it any form of cannabis that you swallow goes in your stomach. So everybody in Colorado always thinks of edibles as being chocolates, brownies, gummies, pills, etc. And it doesn't make any difference if it's an oil or in one of those, but if you swallow it and it goes into your stomach, it's considered an edible. So disadvantages for those people who want to use them to get high, and this is where they have a lot of problems in Colorado when they first started doing edibles, because people would go ahead and take the gummy and they'd wait 15 minutes to say, I don't feel anything, I'll take another gummy. You know, and then about hour 1 or 2, they started kicking in and they go, whoa, you know. So it takes about an hour to get in unless it's absorbed. So I think I just saw somewhere around 6 to 10% of the cannabis is absorbed when it goes into the stomach. But this is for my patients with chronic pain and chronic conditions. This is why I really push edibles. Lasts a lot longer. And if you're wanting to stimulate your endocannabinoid system to get rid of the inflammation, etc., this is the way to go. More is metabolized by the liver, so if it goes in your stomach, the first shot is to go to the liver. This is one of the problems with the people that have the THC one, and the THC is that gets absorbed, it gets metabolized into Another form of THC that's about 10 times more potent than the THC that if you smoked it. And best method for treating chronic conditions. Okay. Tinctures and oil can be used sublingually. You hold it under your tongue. Some of it's absorbed by the oral mucosa and the blood vessels, and you hold it in your mouth for about 5 to 10 minutes. But it's obviously going to trickle down, so some of it's going to get into your stomach too. Okay, gets into your system a little faster, 30 minutes instead of an hour. Doesn't stick around quite as long though. But if you have somebody who needs relatively urgent relief, say for pain, but doesn't want to smoke, this will be the way to go ahead and get it into your body. Very good for adjusting doses. You have the droppers, you can say, okay, I'm going to take 5 drops, I'm going to take 10 drops, or if the dropper is marked with mLs, you can go ahead and do it that way too. Salves, not psychotropic even if they have THC in them. Seem to work on both musculoskeletal pain as well as skin conditions. So I have a lot of patients who will go ahead that have arthritis in an elbow or a knee or something that will go ahead and use this. Appears to have some antibiotic as well as anti-cancer properties. Some people have used it for skin cancers and said that it really worked. My experience, if it's deep pain, the salves don't tend to work as well. So my patients that have chronic back pain, if they've got arthritis in the hands, they seem to have a good result, or in the elbow or whatever. But when you get into deep muscles, I haven't had as much success using that as opposed to using like the edibles. But they're worth a try, because if they do work, and I've not figured out any pattern other than how deep the pain is as to why it works for some and doesn't work for others. Suppositories. Probably wouldn't use too much here. We'll talk about that a little bit. But if you're trying to get a high dose of cannabis, or you're not tolerant to oral cannabis, so this would be somebody who has cancer. And a lot of times with cancer, you're talking about 600, 800, 1,000 milligrams, even if it's THC. So you're using really high dose. And you obviously can't take that without getting really, really, really high. But it's not psychoactive even if it has THC, so you can have a THC suppository, okay, and you won't get high. Again, useful if you try to get a high dose for treating cancer. However, this is one of the things, and I don't know about this because we don't usually do this with just CBD, but if you're dealing with rectal signaling problems, so somebody's had prostate cancer, they've had radiation, they have radiation proctitis, because it delivers it right there where the area is inflamed, etc., that it may work. And you can make your own suppository, learn how to do that. However, Elizabeth told me she'll tell people how to do that. So, dosing. I think this is real important because people don't understand. It's amazing how many patients that I've seen, because I've only been with this clinic for about a year. I see patients who have been getting their card for 3 or 4 or 5 years. And I ask them about what they're using and stuff, and it's almost always by trial and error. They didn't go out and learn about it. They said, well, I tried this and I tried that, etc. And I took CBD for 3 or 4 days and I didn't feel any better, so I quit. Okay? So it takes about 3 weeks for it to get into that endocannabinoid system. And what we think it does is 2 things. We think it actually tells the body to make more receptors to the CBD, to the THC, as well as telling the body to make more of its own endocannabinoids. So kind of a dual thing. Sweet spot, real important, especially this is real important with seizures and stuff. So when you start taking cannabis, whatever form it is, you have your symptoms over here and you have your dosage here. When you go ahead and start increasing the dose, you will find out that your symptoms start to go down, and then when you get past this sweet spot, so it's a bell-shaped curve, if you end up taking more than your body needs, your symptoms can actually get worse. So with children with seizures, we see this all the time. You'll increase it, seizures will get better. Think, okay, well, they're still having some, let's increase it a little bit more. Seizures will get better, let's increase it a little bit more, seizures got worse. It's because they passed their sweet spot. And this is true for most of the symptoms that you have. So you have to be cautious about how much you take, and I think the next thing,
I had a thing with that. I remember that I told you that I switched to Nova to On, which is stronger, and I took like 15 drops on the first dosage, and I was also taking ashwagandha, and my blood pressure dropped like crazy. When I told them, they were like, "Oh my God, what did you do?"
what happened?
Yeah.
So, like I said, if you go past your sweet spot, it can get worse. So if you increase the dose and your symptoms are not controlled and you feel worse, you need to back off. Because your typical response is, I'm getting worse, I need to take more. Okay, I need to take more ibuprofen or whatever it is, and you're actually making it worse. So what you need to do is you back off, see if your symptoms improve, because if they do, that means you've gone past your sweet spot. This is a problem I have in the United States, is that they think, well, you can go buy it, it's like getting vitamin B off the shelf or whatever, and they don't think about how it interacts with other medicine, etc. And when I talk to my patients, I say, what are you doing? They say, well, I'm taking an edible. Well, what's in it? I don't know. Well, is it THC or CBD? Well, I think it has both of them. Well, how much? I don't know. So you need to really think about the dosing part of it, because that's real important. And unfortunately, because of all the marketing in the United States, they just think, well, shoot, you just go out and start taking it and that's it. It's going to fix everything. Means being aware of your dosing if possible. I like to deal in milligrams, so you have the bottles of the label here. There's so much in each drop. You know what's in each drop, and you're not going up and down as far as how much you're taking. Real important. Start low, go slow. Okay? That's going to be frustrating sometimes because people want immediate relief. They just,
Thank you.
but you need to start low and go slow. My way of dosing it is to say, and I think I have it here. We'll look at it. I think I'm pretty sure you do. Extreme variation amongst individuals. Extreme. I can't emphasize that enough. I have patients who are taking maybe 20 milligrams of CBD a day, and they're just great. I have other people that have to take 100 milligrams of THC and CBD to get their symptoms under control. So, and there's no test to find out how you respond to it. So that's why I always say, you always start low and you gradually build up, because once again, if your symptoms start getting worse, you go, okay, maybe past my sweet spot. And the answer is not to go ahead and just stop at that time. The answer is to say, okay, is there something else that I can add? Hard to do in this area unless you go ahead and get some stuff from somebody else, okay? But in the United States, you can say, okay, now we're going to add in some THCA or something else. Again, 10 milligrams to over 100 milligrams per day. So this is sort of how I do it when I go ahead and start. I start off with 10 milligrams of CBD once a day. And then every few days, I'll go ahead and say, okay, now you're taking 10 milligrams of CBD at night. Day 4, you go ahead and add in 5 milligrams of CBD in the morning. Day 7, you go ahead and add in another 5 milligrams. So you're sitting at 20 milligrams. So you're about 1 week into using this stuff. But again, because it takes about 3 weeks, I say, okay, you need to stay at that level instead of just keep cranking it up. As a rule, again, kind of depends on symptoms, but you need a chance for your endocannabinoid system to catch up. And then once at 20 milligrams, I stay there for 2 more weeks. I tell them to take it twice a day. I said that if you do an edible, it lasts 6 to 8 hours. So if you pretty balanced, there are some exceptions where we have people take it 3 times a day, but as a rule, twice a day is going to give most people pretty good relief. And it's best absorbed with a little food. So if you take some fat with it, because cannabinoids are lipophilic. If you take something like cheese or something that has some fat in it, what it does is it releases the enzymes that digest oils, fats, etc., and you get better absorption.
The dosage depends by weight and condition. The dosage of every patient.
You can have the same people, same age, same weight, totally different dosages. So it doesn't, and the same condition. So it just, the more, say if you're dealing with pain, generally as a rule, you would end up with a higher dosage, but there's no way of telling, you just, everybody has to find their own dosage, is that, yeah, okay. Most side effects we talked about are from THC. Very few side effects from CBD, but may include dizziness. Interestingly, or some people will say I took some CBD and I got drowsy and sedated and stuff. Not very often, but it does happen. Stomach upset, so they get cramps, maybe some diarrhea, stuff like that. So those are the most common things with CBD. But as a rule, side effects are pretty low. THC, you can get diarrhea, nausea, sleepiness, dry mouth, mental status changes. You hear people talking about schizophrenia, anxiety attacks, etc. with THC. Generally, that's when they get into a really high dose. And we don't think, they used to think that THC caused schizophrenia. What we think now is that probably just unmasks stuff that was already there. Increased heart rate, paranoid. One of the things that we said, one of the things you have to worry about is that it can affect the blood pressure as well as the heart rate. So if you have somebody who has severe heart disease, you have to be really, really careful. Again, not a common thing with CBD. We already talked about this on the internet. Cannabis clinic in the United States, we have what we call mills, where they just have people come in and they, when I first started this and didn't know any better, they would have me see 6 to 8 patients an hour. They come in, what do you have? Okay, you qualify, here's your thing. And then they told me to go tell them to talk to the bud tenders, who are the kids behind the counter. They're probably working behind the counter because they get better quality stuff at a lower price. And it took me about 3 months to find out that they didn't know anything about medicinal use of it. So, cautions on buying, we talked about. Readily available over the internet. This is one of the things that we're going to go back in the book, but this is one of the places actually in Colorado Springs. This was started, the realm of caring, by Charlotte's mom. So that Charlotte Figge of Charlotte's Web fame, her mom and the Stanley brothers put this together, and the realm of caring does nothing but educate about medical cannabis. They don't buy it, they don't sell it, they don't grow it, they just educate. And if you go to their homepage at the bottom, they're going to have Stanley Brothers and Elixinol, and about 6 or 8 different types of CBD products that they've vetted to find out that they're quality. Of course, here we want to do this. Okay. Again, back in the States, you would look for a whole plant because it has the terpenes in it. See if it's been tested. All right, so we talked about the history of cannabis and how mankind has been with mankind for at least 10,000 years. Why it became a Schedule I. We talked about the endocannabinoid system and the CB1 and CB2 receptors, differentiated between hemp and marijuana. Hemp has less than 0.3% THC. Marijuana has more. Safety profile of cannabis, nobody's ever died from it. That doesn't mean people haven't done stupid things and died from cannabis, but, not from the cannabis.
They were stupid anyway.
Yeah. Terpenes, drug interactions, I just can't emphasize that. I did Hippocratic Oath, do no harm, etc., so I'm just really focused on that. Talked about the common cannabinoids. We talked about the entourage effect with both different cannabinoids and the cannabinoids and the terpenes. Used it for chronic pain, just seizures, cancers, autoimmune diseases. I'll tell you, in terms of autoimmune diseases, the rheumatoid arthritis, the fibromyalgia I talked about and stuff, just amazing results from the patients who use it right. I didn't talk about migraines. It works. You see, even CBD works great for migraines, for blocking migraines. And sometimes in the United States, patients who get a CBD vape pen, and they'll be taking CBD2 and they have a migraine start, they go ahead and vape on the CBD vape pen. That's the end of the migraine. So it's just absolutely amazing. But even that, when they take a CBD on a regular basis, it'll go ahead and really decrease the types of migraines or the number of migraines they have. Same goes for menstrual cramps. Just absolutely works great.
So if a person have a migraine just like one a month, that person have to take the CBD regularly, or it can take it just for that, that?
Well, it would depend. So most of the time, I don't find that my patients who have one a month are gonna do that. These are the patients that have one a week. They're gonna be taking the CBD regular because of how frequently they have the migraines. What I would do with somebody who has one a month in the United States is I'd say, go get a CBD vape pen or get a CBD sublingual. Try that and see if that does the job, okay?
Okay.
So if it does, that's fine, then they only use it that one time. But most of the time, the people who are using it regular or have multiple episodes,
Okay,
okay?
thank you.
Multiple sclerosis we talked about with the muscle spasms. Colorado Springs is a military town. Whole lot of veterans from Iraq, Afghanistan, PTSD. I've seen a whole lot of them get off the opioids, get off of their antidepressants, their antipsychotics, because they're using this the right way. So it really works well for PTSD if they use it right. Again, great for depression and anxiety. We talked about plants and the trichomes, and the flowers, the edibles, the concentrates, topicals, methods of consumption, smoking, vaping, etc. Smoke it, gets in rapidly, goes out rapidly. Drop it under your tongue, kicks in 30 minutes, gone in about 3 to 4 hours. Edibles takes about an hour, but lasts 6 to 8 hours. Salves, moderate onset, my patients kind of tell me that maybe about 15 to 30 minutes, tend to last about 2 hours, maybe 3 hours. They use a topical. Suppositories that you need to get high doses, or if somebody can't tolerate taking it low, or a tincture or something. Start low and go slow. Start low and go slow. Wait, takes up to 2 weeks to get going. Don't forget about the sweet spot, or if you go past it, your symptoms can actually get worse. Side effects are low for CBD, and most of them are GI. Look for the whole plant or terpenes added back, like we do here. Caveat emptor is for the people in the United States because it's buyer beware. Caveat emptor is just because what I just said about when you buy it off the internet. Okay, now.